It's 75 times deadlier than COVID-19, killing at least half of its victims, and now a top UK scientist has warned it's one of the world's next pandemic threats. So what is the Nipah virus, and how worried should we be about it? It may seem a little early to be talking about the next pandemic, but one lesson the world has certainly learned the hard way since early 2020 is that it's always best to expect the unexpected. One UK scientist with a keen eye for possible health disasters is Professor Dame Sarah Gilbert, creator of the Oxford AstraZeneca vaccine. She recently said that one of the world's next pandemic threats could reside in the deadly Nipah virus. Speaking at the Cheltenham Literature Festival, Professor Gilbert said that should the Nipah virus mutate into a variant that spreads more easily, in the same way that the coronavirus has evolved into the more infectious Delta variant, then the world will be facing a highly transmissible virus with a 50% fatality rate. A scary thought indeed. It's not just Professor Gilbert feeling anxious about the Nipah virus's destructive credentials. The US Centre for Disease Control and Prevention warns it has the potential to cause a pandemic. It's in the top 10 priority diseases that the World Health Organization has identified as potential sources of future epidemics. And scientists have previously told The Sun Nipah could absolutely be the cause of a new pandemic. So what is it? Nipah is one of a family of viruses carried naturally by several species of fruit bat across southern Asia and Australasia. It causes respiratory infection and brain damage and has a mortality rate in humans of up to 75%. Nipah virus infection begins with flu-like symptoms, including headache, fever, nausea, vomiting, and dizziness. It also causes the brain to swell, which can be fatal. Patients experience confusion and persistent drowsiness, and in severe cases can fall into a coma within 48 hours. There is currently no vaccine, although work to develop one is ongoing. In fact, Nipah is one of several diseases Professor Sarah Gilbert was working on developing a vaccine for until COVID-19 struck. Now, she says that work has gone backwards, and without adequate funding to develop a jab for it, the threat of a deadly outbreak of the Nipah virus remains. So far, outbreaks in humans of the virus have remained relatively small, but deadly nonetheless. In 1998, an outbreak in Port Dickson, Malaysia, killed 100 people out of 300 who were known to be infected. The outbreak was traced back to a farm, where it is believed pigs ate fruit that fell from the trees where infected bats had been feeding. The sick pigs then spread the disease to their handlers. More recently, in India, public health authorities have been working hard to trace the origins of an infection which killed a 12-year-old boy in the Kerala region. Police put a 2-mile cordon in place around the child's home while health officials attempted to trace and isolate any people he had been in contact with. On this occasion, it appears the virus has been successfully contained. But every opportunity Nipah gets to infect humans presents a possibility of it mutating. And if one of those changes makes it better at passing through humans, the consequences could be dire.